How autism presents differently in boys versus girls. It doesn't. Autism doesn't present differently by gender, but how we perceive autism in relation to gender is affected by misogyny and our own biases. In boys, stereotypically male special interests are seen as autistic traits, versus in girls, special interests in makeup, clothes, and dolls are seen as just silly girl things. In boys, communication differences are seen as autistic traits, versus in girls, communication differences are seen as being annoying or just shy. In boys, sensory differences are seen as autistic traits, versus in girls, sensory differences are seen as being picky and exaggerative. In boys, a need for sameness is seen as an autistic trait, versus in girls, a need for sameness is seen as being difficult and dramatic. In boys, developmental differences are seen as autistic traits, versus in girls, developmental differences are being more mature for their age or just ditzy. And as a result, boys are more normally diagnosed, giving the impression that boys are more autistic, and girls are underdiagnosed, giving the impression that girls are less autistic, which isn't true. But just like gender isn't binary, neither are these experiences. Gender diverse folks don't fit into these stereotypes and face increased barriers to diagnosis and care. Gender also isn't the only factor. Racism, socioeconomic status, anti-trans or queer violence, compelling disabilities, and much more all have an impact too. And luckily, diagnostic criteria has improved a lot over the years, but societal biases still prevent so many women and gender diverse folks from getting care.